Good morning, everyone. Today, along with the celebration of the Hand Hygiene Day, I'm giving this lecture just to remind everyone and reinforce the hand hygiene in Okay. So I started to my lecture with this, and maybe this sentence, these two words, it can summarize the whole lecture. Everyone is accountable, okay? Everyone working in health care facility is accountable to do the hand hygiene. So as I like to start my lectures as always with some history. This guy here, his name is Ignace St. Louis. He started or linked the hand washing to the health, and that was 200 years ago. So this concept is not really new. The evidence since long time is there between the hand washing and the health or infections. He was the first person to realize that keeping hands clean can really help in preventing diseases, and that's in 1846. This lady, a few years later, during the Crimean War, Florence Nightingale was the new hand wash champion, implementing hand washing in the ward hospital where she worked. What they both did, it's promote for the was not widely accepted till 1980s. So this concept is not widely taken by all the healthcare facilities till the 80s, in spite of all the evidence since 200 years ago. So since 80, health or hand washing or hand hygiene is a concept of or a pillar of a healthcare facility to reduce infections, of course. So what's hand hygiene? Hand hygiene means cleaning your hands by using either hand washing when you use the soap and water, or antiseptic hand washing or antiseptic hand rub where you use the alcohol-based hand sanitizer including foam or gel, or the surgical hand antisepsis. So all these definitions, it's under the hand hygiene. So that's, just to summarize, always we have a reservoir or a host that has an infectious agent. This infectious agent, has a reservoir. The reservoir is the host himself or herself and her environment. Okay? I'm talking about either the patient, because this cycle can be from like patients to doctors, or the opposites, doctor to patients. So it's a cycle. We have a portal of exits, then transmitted through a portal of entry to the other host. So it's a chain. If we want to control this, we have to control and break the chains, especially at the time of cleaning the reservoir, controlling the exits, controlling the entry. So that's the portal of exits. Patient is coughing with a lot of infectious particles all over. This is the mode of transmission. This is this is the mode of transmission, and this is the mode of entry. Okay, and it can be vice versa. So why we're doing hand hygiene? It's mainly to control the healthcare associated infections. Why we want to control the healthcare associated infections? Because it can increase morbidity of the patients, increase mortality of the patients. It can prolong stay, and that will promote the long-term disabilities and the financial burden, not only on the health services, but also on the families and the patients themselves. So that's like there is an increased morbidity, increased loss of patients, and financial burdens also. So one of the single most effective measures to prevent healthcare-associated infections simply doing hand hygiene. Okay, if it's done properly, can be up to and over 90% effective. So don't underestimate doing the hand hygiene properly. It's really, really very, very effective. Up to 70% of the healthcare-associated infections are preventable. Preventable by what? By doing the hand hygiene. Okay, so who should do it? As I mentioned before, everyone is accountable. Okay? How we're doing it? We use the water and soap or the alcohol. The time is 40 to 60, so please spend time. 40 to 60 seconds for water and soap and 20 to 30 seconds for alcohol. Alcohol, if it's correctly applied, it kills organisms in seconds in routine care, except if the hand is visibly soiled or you are caring with a suspected or confirmed case of C. diff, then you have to do the hand washing. Okay? Water and soap, if it's done correctly, it's removed organism. Trust me. You have to remove the wristwatch and the jewelry at the beginning of the work. No long sleeve when you apply any patient care. Even if you're working, you have to sleeve it up. Keep nails short and no artificial nails. It's the trend now. No more artificial nails. Anyone can do the hand hygiene? Can you do it for us? I want to do it, but my hands is...
Bun to bun.
Yes?
So we can just second in بعدين bun to bun.
Okay.
1, 2, 3, 4, 5, 6.
If you can go up there, so everybody.
Can you do it?
Okay. It's good. Thank you. Thank you for.
So, but we are
No, I
taking
even
the
know
alcohol.
what that.
We are taking the alcohol.
Yes.
First with hands,
Just take
then
that
take
one.
soap, yeah.
Yeah. She need to do the technique. So in alcohol rub,
Yeah.
make this one. Bun to bun. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6.
Okay.
4, 5, 6. I will take like that. And share.
Okay.
This is
And
the-
wrist, yes. Wrist, it's not on all the brochures,
Thank you.
but I like to include the wrist always. Thank you so much. So, you know, it's easy to do. Easy to memorize, okay? So, when you have to do it, this is the 5 moments. Can you tell us what's the 5 moments?
Before patient contact, after patient contact, before exposure to body fluids, after cleaning the procedure, and remember
2 before, 3 after.
Before
After
touching the
surround.
patients? Before
Procedure.
Okay.
After
After?
touching.
touching the patient, after body
Okay.
fluid
Body
exposure,
fluids and after touching
And
and
after surround
touching the
surface.
yes, after being in the
Touching
surroundings or touching the surroundings of the patient. And please focus on the touching the surroundings, okay? Because you will see why I said that. So I just wanted to take you in a journey of the hand hygiene in Baksh Hospital. So from 2015-16, the hospital-wide compliance to hand hygiene in 15 was 62. It did improve in 16 to 75. And then in 17 and 18, it's reached its 80, mid-80s. In 2019, there was a good compliance reaching the 90s. And in 2020, we reached the maximum we got because of the corona and everything. So everyone was obsessed by doing the hand hygiene. Obsession is good sometimes. It's dropped again to 90s into 2021. And in the first quarter of 2022, we noticed that there is a drop to 80s. in which we initiate the high five projects. Now, all you know what's the high five?
Yes.
Okay. We did notice some improvement after then because we initiate the high five projects in late February. So we've been doing this for the last 3 months. So there is some improvement in the compliance. I wish we continue doing the good job. We'll continue doing the high five for a while till we are sure that everyone's got it. And I know you can do it. Okay. So this is just to show you the compliance according to the healthcare workers. The best are the respiratory therapists doing the hand hygiene, that's expected. But here, doctors and nurses, usually there is a big difference between doctors and nurses usually way better than doctors. But here, as you can see, there is no big difference between the nurses and doctors. So we need our nurses and doctors to improve it a bit. Here it's by departments, ICUs showing maybe the best compliance. So we need the rest of the departments to follow. Here, that's why I told you just focus on the when you're being or touch the patient's environment, because the least compliance is when you are in the patient's environment or surroundings. So in summary, everyone should be meticulous about hand washing. It's not something like trivial or something that you should underestimate. Support and remind each other, please. If someone you notice that he's not doing the proper hand hygiene or you're forgetting to do the hand hygiene, remind and support. Consider hand hygiene as a lifestyle. You should actually, hand hygiene should be like done in health facilities, in working companies, at home, at schools. So hand hygiene is really something that we should take it like a lifestyle. And high five. But before leaving, I want just to ask you, when you, which point you feel that there is a struggle with the hand hygiene and there is a challenges about doing hand hygiene? Do you feel this sometimes? There is some challenges or struggle to do the hand hygiene? Anyone?
Wallahi, for me, I've been doing hand hygiene very well until a moment, and then I stopped almost completely.
Why?
The reason, sorry to say that, over cleaning my hand make it like very allergic and sensitive.
Okay.
And I stopped doing surgery for at least 3 months because of this allergy.
Yes.
And that's why I'm very careful now when I do those kind of hand hygiene.
Okay, so hand allergy, some sort of dermatitis is a well-known side effects of doing hand hygiene.
Because I think
especially with the soap and water, not with the alcohol.
Because I think we overdo it. I said, if I gonna touch, if I gonna clean my hand with every patient,
Yes.
then absolutely I'm gonna destroy my hand.
Yes.
صح
But
ولا لا؟
maybe for a surgeon, you have to do the scrub before each operation.
That's enough.
No. Before touching the patients, but as I mentioned, if you try the alcohol drugs, it's the percent of dermatitis is way less than when you do the soap and water. Okay, and soap and water usually will accelerate and damage the hands if you're doing it more than 7 to 10 times per day. So 7 to 10 times, this is the cutoff when you feel that your hand is very dry and there is some sort of dermatitis. That's why also you should keep your hands also moist. So use creams and yes, after each care. Okay, for the nurses, how many times do you think you're doing the hand hygiene in your shift? How many times usually?
depends about the work. If the nurse, she will go
Okay.
every time to the patient.
An average
She's
number.
working
In average.
average
7 to 8.
7 to 10 times.
7 to 10 times? Okay. So based on the studies, that's very low number. Based on studies, after a single patient care, you are touching around 15 area of the patients after a single patient care. So if 15 service you will touch. So that's mean in your shift you're touching around 900 services. Okay. Accordingly, your hand hygiene will be 15 to 20 times per shift for an average nurse. Okay. So when you just observe yourself and observe how many times you're doing it, you're doing it right. You're doing it at the exact 5 moments that you really need to do it. So when and how is very important. I want everyone to reflect on himself or herself in doing the hand hygiene. Okay? We want to first for sure everyone wants to decrease the infections. Infections not only in the health, infections on ourselves also, on our beloved ones at home. It's not only just to control it in the hospital. So please always reflect on yourself about the hand hygiene, how we are doing it, when we are doing it, and why we are doing it. Okay? I think by doing this with continuous reminder of our high five, we will get there and we'll get we will try to control our hospital-acquired infections. Okay? Thank you so much. Any questions?
No, Doctor, is there no study that how our improvement in the hand hygiene decreased our health hospital acquired any studies?
Yeah,
with
there's
a
a lot of
comparison
studies. That's a lot of studies.
here in our hospital?
No.
Any comparison to say that, to show us an achievement that we increased on our hand hygiene and it decreased?
I don't think, because the rate of the hospital-acquired infection almost zero here.
Yeah, yeah.
That's true.
Yeah,
the rate you reported every time,
It shows
Yes.
that.
zero wound infection, zero catheter-related infection, zero VAB.
There are, yeah.
So that's another problem. Because we think that maybe this infections, hospital-acquired infection, is not reported in the way it should be. So there was like some under-diagnosis of our hospital-acquired infections. Don't get this fact that, you see, no need to do the hand hygiene. Don't just get it this way.
I'm sending
But-
the opposite message.
Yeah, because
We are being overconfident.
there is a lot of evidence since a long time, a lot of evidence support that the hand hygiene will control the infections, whatever, hospital acquired or else. Okay, so but from our hospital we don't have like a study to prove that.
Dr. Abir, how you do the statistic of the unit 4, they're doing much better than the others? How you guys
So
do
it's
it?
based on the observation.
You observing the people?
The infection control staff are observing, and the head manager, the nurse manager.
It's spying.
So hopefully
It's fine,
this is
We
like,
yeah?
are making indicator every day.
My
I
goodness.
have
so,
suggestion.
I
So
hope
they
that there is
observing
no
us.
fake results about this.
Ah.
I have suggestion related to the accuracy of our documentation. That
Okay.
before we are using hand hygiene for
That's
hard
another
copy.
thing.
Hard copy is better than electronic. When I observe anyone doing hand hygiene or stuff, I will document directly, not like electronic. So I think it's be more accurate than this way, what we are using now, electronic.
I think there is. Yeah.
Before
You
we
mean
have hand hygiene, hard copy. before.
what's the difference between hard or soft?
Different is more easier for us when we are observe the person while he is doing. We directly
So you can do it hard copy
Hard
at
copy
the end of
and
the
then
shift
yes.
And
to
this
introduce
is a
it.
double one. I
Uh,
will enter.
Double
also
check.
the-
Or just send
before
it to
we are
hard copy,
submitting-
send it to the infection
yes,
control.
before we are submitting directly those hard copies.
So
not accurate
we
now.
wanted to decrease the hard copies as much as we can.
But
But if
for
you
hand
feel
hygiene-
that this is like
It's very
For
important.
hand hygiene, doctor, I'm telling you frankly, all it's fake. The one we are
Yes.
doing since electronic, it's
you
almost
so much.
fake. I'm telling you the
You
truth.
will
That is the summary of
You
the
need
whole
to-
Just destroy the
lecture
whole
that you
lecture.
have given.
You need to minimize the paper, but I'm telling you the real
We are
because
telling
I'm
the
observing dietitian, the doctor, blah blah blah. So how I will reflect immediately?
I will document directly in the hard copy. It's more
And you
easy.
write doctor, they don't do it.
so
Surgical,
when you
Dr.
observe
Ahmad
it,
Habib.
mention the name.
And you mentioned the name as well. My goodness. My spine.
sometimes this is maybe the next step. If you show like
Yes.
we will go by names.
So this is my suggestion to be more.
But why you don't use the camera? Why
Why monthly?
Why don't you use the camera?
Actually, we did suggest
Like
that,
random
yes,
selection of time
but
and.
there is political issues about it.
Mm.
So, but we do suggest about that.
I think it's just a training, not only for nurses. Nurses always have training. Like in the orientation, any nurse coming to the system,
Yeah, that's,
she has
that's
4
why
or
I
8
said
hours.
everyone is accountable.
Same. So
Okay.
medical also. I'm not talking not only paramedics, medics.
Yes,
everyone should have a
Yeah.
particular training on
If
infection
you notice,
control and
for example,
practicals.
the housekeeper is not doing the
Practicals,
proper hand
practicals.
hygiene, go step in and teach and make sure that